Artificial intelligence is changing the game, and healthcare isn't far behind. How's the world of radiology evolving in light of AI technology? What repercussions does this have for public healthcare systems that are already under the magnifying glass? And just how do we navigate these choppy waters of integrating advanced technology in settings that are resistant to change? Public healthcare is full of complex systems and red tape, and artificial intelligence can potentially streamline processes and enhance patient care in ways we can't even imagine. The integration of technology is not simple, and with AI, the stakes are high with questions on patient safety, data security, and provider acceptance that are bubbling to the surface. On the show today, Sophie Turner from Talking HealthTech speaks with 3 radiologists who know the problems to be solved firsthand. Dr Jennie Roberts, Professor Catherine Jones, and Dr Sajith Karunasena. And in this episode, we talk about the perils and promises of artificial intelligence in diagnosing and managing patient care and the challenges it poses for public healthcare systems. The strategies required for the successful integration of artificial intelligence, balancing innovation with patient safety and provider training, and the ever-important measures of cost-effectiveness and return on investment that come along with any technology investment. Collaboration starts with the conversation, Team HealthTech. Let's make it happen.
Welcome to Talking HealthTech, featuring content and community about technology and healthcare. We acknowledge the traditional owners of lands these conversations were recorded and pay respect to elders past and present.
Welcome to today's episode of Talking HealthTech. I'm your host, Sophie Turner, and today I'm joined by 3 lovely people to talk about the intersection of technology and radiology in our public healthcare system. So I know there's a couple of us, so I'm going to throw to you guys to introduce yourselves and tell us a little bit about who you are and what you do. Jennie, welcome.
Thank you, Sophie. Yeah, so there's 3 of us. We're all radiologists. We've all worked with each other in some shape or form over the last 10 years or so. I'm a radiologist that is primarily based in the public system since 2007 at the Royal Brisbane Hospital. So I'm kind of entrenched there now. And I'll pass on to Catherine.
Thanks, Jennie. My name's Catherine Jones. I work in the private sector for iMed Radiology. I also do work in several public hospitals, and I'm the former director of medical imaging at the Royal Darwin Hospital. Sajith.
My name is Sajith. I've trained in the public system, graduating in 2022. And since then, I've been working in the private sector in iMed Radiology, but I actually work in a public hospital predominantly in North Brisbane.
Wow, so Brisbane and Queensland represent today. I'm based on the Sunshine Coast. So that's
Awesome.
quite nice. It's not often we get to do an episode and everyone is Queensland based. So we'll do a little shout out for the Queenslanders. I'm excited to dive into this as a clinical nurse myself, sort of that the workflow and how we all sort of use AI and particularly in that space of getting those images and those reports for our patients to make those decisions. I'm going to throw, to start it off, Jennie, what are the current challenges faced by the public healthcare systems in integrating the tech, especially AI, into their operations?
Thank you, Sophie. That's a great question, and there's many, many layers to that. And there's so many challenges, and in particular, integrating technology. A couple of years ago, I read a email from a former director of Queensland Health, Sean Drummond, and he described the Metro North public system, or any big public system, like a large liner, like a large cruiser on the ocean. And so if you want to change something, or you want to change directions, even if it's just going a little way, it's quite a big deal. And there's a lot of processes and a lot of people, there's a lot of layers. So it's not a small system. So change doesn't happen quickly. And as we know, technology is happening really quickly. So to try and keep up, it's not easy. And there's lots of other factors as well. Another huge factor is funding. So the cost of healthcare is increasing, especially, medicine is amazing now. Like 10 years ago, people that would have passed away from a cancer are still living. And it's awesome. But as a result, we're doing more imaging. It costs us more time. It's such a good outcome, but it puts a lot of pressure on the health system. Getting AI, we really do. I believe we really would benefit from having AI through our system, and it would just getting through those layers. But hopefully, we will get there. Thank you.
Wonderful. Lots of complexities when you're looking at a big health system, particularly one like Queensland Health. All right, Catherine, I'm going to come over to you. I'll throw this one to you. But from your perspective, what are the critical success factors that contribute to the effective implementation of the technology?
So there's a couple of really key things, and it's really the same whether it's public or private healthcare, but particularly in the public healthcare system, senior executive support for change is key. And as we know, there are many competing priorities within such a large organization, which is essentially publicly funded. So we really need to make sure that our senior executives are aware of the current issues we're trying to solve with AI and the evidence that AI can actually solve those problems. So once the senior executives lend their support, things tend to move more quickly after that. Once that happens, of course, you need to have a framework in place to make sure that the AI is actually addressing problems that exist, and that it will be used safely, with patient safety paramount at all times. Then, of course, comes resourcing. So as Jenny's already alluded to, it's the funding, but it's also the resourcing in teams like your IT team and your education teams. And then once we've got all of that, of course, you need a framework in place to be able to measure the effect of the implementation to ensure that it is actually producing the benefits that you wanted in the first place. So the public health system wonderfully has all of those frameworks in place for many other things already. And that's really where it has a head start over many of the private healthcare systems already out there. Governance is done really well in the public healthcare system. So once we get that senior executive support, it should be pretty straightforward after that.
So again, lots of pieces, but obviously quite fundamental in all of that, and bringing new tech into clinical processes is that governance and patient safety. What regulatory parameters should healthcare professionals and technologists be mindful of, Catherine, and how do we navigate these?
Yeah, that's a great question, Sophie. So we have multiple layers of, if you like, requirements that we need to make sure we're meeting. The first requirement really is that we're meeting every legal requirement. And one great example of that is protecting, patient health information under the Privacy Act. So to ensure that again, remains a baseline foundation for all of the implementation that we do. Then, of course, we come to, are there particular guidelines around the use of a particular product? And when we look at products that are being used as clinical or medical devices in particular, these need to be approved by the TGA here in Australia. This is, of course, mirrors other processes around the world with the FDA in North America and, CE marking in Europe. Those approvals will come with indications for use. And so when any organization, including the public health system, would like to implement a medical device, it's knowing that we are implementing it in accordance with the approved indications for use. Then, of course, we have, as medical professionals, we have requirements that we need to meet to the Medical Board of Australia, to APRA, and of course to our own organizations. So in this case, we have recommendations for code of conduct and best practice put out by the Royal Australia and New Zealand College of Radiologists. So there's multiple levels of requirements, from the very, mandatory legal ones through to the what is best and ethical practice for us in our own chosen specialty. So there's lots of layers to navigate with that one.
Yeah, thank you. And I'm sure as tech is evolving in as rapidly it is now, and health is, notoriously a slow moving beast, trying to incorporate all of that governance around the tech can be quite challenging in itself. Sajith, how can AI contribute to heightened service delivery excellence in public health? And what strategies should be employed to strike the balance between the tech and the human-centric aspect?
So first off, the institution that I work at, we currently have AI assistants that act as radiologist aides, and in particular, they help with chest X-ray and CT brain studies. I'll give a really quick overview of how this actually works because I think that's important. So when you open a radiology case, a small viewer will pop up that has a list of findings that the AI detected in that study. And then if you hover over that the findings on the list, it will open up a little preview thumbnail. And if the finding is localizable, it'll highlight it in purple for you. Additionally, at the bottom of the thumbnail, it gives you a little bar of confidence, and that tells you like how confident literally the model thinks it is that that's the diagnosis. It's kind of like when a radiologist in a report says something possibly represents X or something very likely represents Y. Looking at it work on subtle findings like tiny lung nodules or really early ischemic strokes with a difference in the shade of the area of the brain affected on the screen is almost barely perceptible is really quite cool. It's made me look like a detection hero to my clinical colleagues on many occasions where I hide that little window and show them on the pack screen. So how do you strike that balance of like excellent service but remaining human-centric? So this is very much like having a second reader available for every case that maintains its performance, doesn't get tired, and it really serves to help reduce radiologist errors and the negative patient outcomes that can arise as a consequence. The radiologist is still very much completing their normal workflow, and they sign off the reports and take legal responsibility for it. And importantly, they create that report in the clinical context. Like they get a history from the referrer, they can have a discussion with the referrer, and what they're doing is integrating what they see, then what their second reader AI has detected, all their information, and then they use that all to come to a diagnosis. So it's very much an addition to a service rather than a different service.
Can I add on to that, Saji? Sorry.
Of course.
It's just going to, like when you're saying like you've got a second reader and the AI doesn't get tired, you can imagine in these really big public hospitals, we have registrars that do overnight reporting. And so they're expected to report scans at 2 a.m. And gee, it would be nice to have that little friend by your side, your little AI, who's not tired, tapping you on the shoulder saying, hey, what about that? So AI doesn't get tired. So keep going.
That just made me think, Jenny, imagine being a day one registrar. Yeah. You're still learning and you've got to learn the ropes over 5 years. Imagine having an AI like what I just described there to just sort of help you learn in the beginning. I think that would be a really good application of the public healthcare system. There's also extensions to this sort of base functionality where the AI is always working in the background and it changes the work list such that it prioritizes cases that have urgent findings on them. So that's, again, helping deliver excellent service, and it's patient-centric because the patients who need care urgently, they get triaged at the top of the list. The radiologist can action it and contact the treating doctor and explain what they see, and then that patient gets their management promptly.
I haven't been involved too much with AI, but in October 2020, somehow we managed to get down to a conference even in the middle of COVID in Byron Bay. And this conference actually showed that when like a big hospital might be 3,000-4,000 chest X-rays behind, the AI will actually scan through those cases and let the radiologist know what is important and what's not. And I thought I spent, I saved all my money, just that line in itself, I think is amazing. I think the conference was worth about $1,500 or maybe it was $1,000, but I just thought that was money well spent to know that. And since that time, we have been really advocating to get AI into our Royal Brisbane Hospital.
I think just one other point to add there. It's really important when you are choosing the appropriate AI, particularly if you're trying to, do this reordering of your work list. It's important to make sure that the AI product or products that you use are comprehensive enough.
Yep.
So Saji's been referring to Annalise AI, so the chest X-ray and CT brain product. Of course, there are many more out there in the market. They all, to some extent, talk about a range of findings, and the more comprehensive that range of findings can be, then the greater impact it can have on sorting out patients into different pathologies, as well as different degrees of time sensitivity and urgency. And of course, that brings us on to the next point of being able to generate preliminary reports for patients. Again, the more comprehensive the range of findings, the better that process would be. Again, as Saji already said, not replacing the radiologist report, but actually enabling them to be more efficient and improve their accuracy. So lots of factors to consider when deciding which AI product would be the most appropriate for your hospital.
I think the biggest bit that I'm sort of taking away there is that recurrence of the efficiency of the system and how we're making that more efficient in terms of the clinical decision making for the clinician, as well as that timely treatment plan for the patient themselves. Saji, how can the AI, further to that sort of, how can we design a more efficient healthcare system?
Yeah. So as Catherine just mentioned, the newest sort of feature of the AI products that we use is the ability to generate these draft radiology reports. Again, maintaining that balance, the radiologist is still reviewing this and inputs their own conclusion at the end of the report. They're still making the diagnosis and signing it off. So the purpose is really to save time on this sort of text generation aspect of the radiology report and allowing the radiologist to focus on that imaging and the clinical problem that they have to solve. It's common knowledge that we are living in a world where the demand for medical imaging studies is greatly outweighing the capacity of the radiologist to report them and how fast we can train them. So the AI assistants that I sort of described, they can make public healthcare more efficient by reducing the time the radiologist takes to create a report. That triage functionality can reduce potential delays to diagnosis for urgent and critical pathologies. So that means patients aren't waiting unattended and potentially becoming worse from their condition. Something that we don't have yet, but I think is going to come very quickly in the future, is using AI to optimize workflows even further. For example, in the public healthcare system, we have many subspecialist radiologists. So they've done extra training in a particular body system. And that means they're inherently going to be the expert, more efficient and more accurate in their area of expertise. So workflow optimization is a big thing that's going to come into play, I think, in the next couple of years, where AI can intelligently allocate cases based on what the findings that it predicts are to the best radiologist to do them at the time. So I think all of these factors are going to help make the public healthcare system use its radiologists more efficiently.
I guess then how do we get, so I think 40% of radiologists are already using AI in some capacity. How do we get the other 60% to champion these changes as well in their workplaces?
So I give a few talks on this every few months. There's I think overall what we can say quite clearly is that society's attitudes towards AI have inherently changed over the last 4 to 5 years. And so if I was having this conversation 5 years ago, it would be a very uphill battle to get radiologists to agree to even consider using an AI-assisted device. Nowadays, of course, people are used to having AI in their everyday lives in many ways. But when we're trying to implement any new change into a workplace, particularly in healthcare, which is inherently conservative and based around patient safety and outcome metrics, it really does involve about 4 main things. The first one is communication. So frequent and very clear communication for the reasons why we might be trying to implement a new technology, in this case AI, the problem that's being addressed by that technology, and what sort of timeline we're looking at. It's really important to identify some local clinical champions, and so people who are interested or maybe already appointed into a role of AI lead for that department. And that AI lead can form a small working group of radiologists and non-radiologists involved in the project and form a bit of a steering committee or a working group to be able to look at all of the aspects of the product, whether that product is right or even to choose a product. It may be that we identify the clinical problem first, and then we test different AI products to find which one is the most appropriate. Once all that's been done, we have to engage the IT people, and they can work in parallel. But then it's about training, offering the opportunity to ask questions in a safe environment, because everybody's understanding of AI is different. And then, of course, once we start using it, all it takes is 1 or 2 cases where you can see a clear benefit to the patient that the AI brought, and then it really hits home to the users that this is a very beneficial tool. So I've often said that the people who are most skeptical of the process at the start often become its biggest champions by the end, because when their objections, are overcome by seeing the benefit, they really do say, well, even I'm convinced, and then they become, the biggest evangelists for AI. So, I'd say that it does take a lot of planning to make sure that the process of change management is followed, because you can have the best algorithm in the world, but if it's not used by the radiologists or the other users, it's absolutely worthless.
And all of that, I mean, a great implementation strategy and new tech does cost money. I think Jenny touched on this as one of the biggest challenges when trying to bring change into an organisation, and particularly one like we have here in Queensland, is how do you measure that cost effectiveness and prove that this is going to make a difference to the bottom line? Saji, how do we measure that return on investment of integrating AI in the public health system, and what benchmarks should we be looking at?
Thanks, Sophie. That's so important, right? Because I guess in the public healthcare system, there's X amount of money to spend on technology, and you've got to spend that money on something that actually has benefit. So in terms of measuring, how cost effective and the return of investment with an AI product, there are some easy metrics, like you can measure a radiologist's report generation time. You can measure the whole department's productivity using the quantity of studies performed over certain days. So they're things we can do basically straight away. And then you can retrospectively measure the turnaround time for cases with urgent findings. And that's something that we've done in the wider IMED institution. I think the reduction in the time taken for urgent studies in CT brain, things like studies with intracranial hemorrhage or stroke, it was reduced from, I think the time wasn't bad initially, it was something like 27 minutes to have a report, but it got reduced to 17 minutes. So at scale, that's a pretty big difference. Another thing you could do is measure the pickup rates of like incidental findings like lung nodules, which you can do through retrospective studies, and compare that to the past where we didn't have AI. More difficult to measure are things like the impact of those early diagnoses that really reduces patient morbidity and mortality, which is arguably the most important thing. Much harder to make those claims in the immediate term, so we might have to wait till we have some implementation of AI at scale to better quantify this impact over a longer time period. But one day we will be able to say that after the implementation of AI, we saw these changes in the ability to diagnose these pathologies much earlier. And there's a huge cost saving there inadvertently because if patients aren't coming to hospital with delayed diagnoses of cancer, for example, that's saving the oncological treatment, multiple patient admissions.
And one thing that's really difficult to measure, but I think will increasingly be relevant, is retention of staff, a more pleasant working environment, and reduced risk of burnout of healthcare workers.
Absolutely. And I just, from my own clinical experience, working in the emergency department and the bed flow of waiting on that particular report or this, and if everything's really busy, then a patient's decision-making is held up by one report. So I imagine all of that will make a huge impact across the health system very broadly. But how do we keep it? How do we make it sustainable? I guess it's wonderful to have these initiatives and a great ROI, but we need to be able to make sure that we can maintain that over the long term. Jenny, what role does the education and training play in this process, and how do we ensure the sustainability of it?
I think, as you say, and education is key. And I think Catherine has said, having champions, and also our college now has an integrated AI training program. So a lot more people are coming on board now. It's quite interesting. Like, I'm 51, so I'm probably the middle age. Like most radiologists, by the time they become consultants, are like, I was 35, probably early 30s, and the retirement age is about 65. So I'm probably in the middle. So things are changing. So when I was born in 1972, and that was the year my dad actually did computer science down in Canberra, and he had to move to a different city because that was the only place in Australia that would actually give him his degree of computer science. And then, back then there was no mobile phones. When I did my medical degree last century, we learned from textbooks. We didn't learn from computers. When people go to lectures now, they take their laptops. We had pads and we had paper. Things are changing very quickly. So I'm in the middle of that. So, I've been really fortunate, I think, to see all of these changes, and and keeping up. And keeping up can be quite hard work. And luckily for me, I've got some awesome colleagues and some younger colleagues and my trainees that I teach, but they teach me all this technology and stuff. And so as a team, I can teach them all the clinical stuff and what to look out for on a scan, but, they teach me a lot of technology as well. So it works both ways. So having a whole team, a support crew, I think that makes it a lot more sustainable.
I just like you're at such an interesting time as well, because who you're mentoring and bringing through is they're digital nomads. Yeah. So this is really cool. Just say, this is all they know, whereas you get to then bring the other aspects of what you know, and there's this really nice transition of both teaching each other.
Yes, it's so true. It's like my daughter, who I'd never heard, like 10 years ago, no one had heard of TikTok. She's now like this micro influencer or something like that. I don't know. And she teaches me all this technology. It's just awesome. So there's a lot and all the registrars at work, they teach, they can teach me a lot. And I think, it works both ways.
It's a good chance for the registrars to pay you back for all the live practice, right?
Yeah. It was worthwhile in the end.
Yes.
I think it is really important, not so much for TikTok, but for the public health system to invest in teams of people whose job it is to make sure that technology advances are kept up to date within the public health system. Yeah. Because as we've said, it happens so quickly, and you can really fall behind in just awareness or knowledge about what is out there to help you address your clinical concerns. And so really, by appointing people into, chief medical information officer roles, which a lot of hospitals now have done, has really, given credence to the fact that this is an important thing for public systems to do. And we'll see more and more of that as time goes on, and we'll see more radiologists like Saji who are really becoming, AI experts. It's not a clinical modality; it's the AI expertise that they can add then to their clinical knowledge. So, this is becoming an integral part of radiology very, very quickly, and I think it would behoove the public system to resource that.
Thank you, Catherine. I think you just sort of summarised
everything
that we've just sort of talked about and where it's headed. Saji, do you have any, from your perspective and your experiences, do you have any takeaways you'd like to leave with our audience?
No, I think AI is obviously going to come into the public system very soon, be that this year or next year. As Jenny described, there's a list of challenges in the public system which make it probably a larger task to do than into the private sector. But I think when it gets there, so long as there's good education around how to use it, and even good education on how to select it, because there'll be multiple AI applications to purchase effectively. If the teams are developed, and we probably should start doing that now, I think there'll be a huge impact. And I think once people start adopting it and seeing the benefits, I think it'll be a natural progression to, expand that as a major part of the technologies that we use in the public sector.
And Jenny, did you have any final remarks for the THT
I'm really
audience?
looking forward to it. I can't wait to as you know, a lot of this has already been said, but it would just help our workload so much more. It will take away the stress, the triaging. I'm looking forward to it.
And Catherine, any final remarks?
Oh, just as someone who, went to university in the 1900s, who would have thought that we would be talking about this in 2024? I'm so glad that we are, because whilst AI is not the messiah to help with all of the issues with healthcare, it is certainly going to improve a lot of things. So let's get behind it.
Catherine, isn't it the messiah?
It's the best one we have. But, I certainly think that there are so many gains that we've already been able to demonstrate. And really, where can we take this? There are so many more things we can do.
Myself and Catherine were both at the American Radiology conference last year in November. We've convinced Jenny to go for this year's one. It's basically a huge exhibition, size of a football field, with all of the radiology vendors in the world. And almost every vendor demonstration area was focused on AI. It was amazing.
Yeah, wow. It's it is going to transform the way in which we deliver healthcare. I think from every aspect, from radiology, imaging, to nursing, to that the clinical decision-making tools that it can do to improve every aspect is amazing, and it's very exciting. It's a great time to be a part of healthcare in Australia, and I think the world.
Very.
Well, guys, thank you so much for your time today. It's been really lovely sitting down with you all.
Thank you.
Thank you, Sophie.
Thank you.
We will see you all again.
Yes.
See you soon.
Thanks, Sophie.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.